wise man said, there is no health without mental health. There are many ways that cause mental health, one of it being drug and substance abuse. Most of the youth abuse bangi, Mira, popularly known as Jabba, cigarette. Others abuse drugs that are sold over the counter. I managed to visit a Hardy Treatment and Rehabilitation Center, which is based in Kirigiti, Kiambu County, and this is what I prepared.
Hi, my name is Kennedy Mwaniki Mbigi. Everybody calls me Beaver. And I'm an addictions counselor at a Hardy Treatment and Rehabilitation Center, which can be found in Kirigiti, Kiambu. So what we do here is basically we try to assist individuals and families who are facing this challenge of addiction to drugs, and just help them to create better lives for themselves and to restore the lost hopes, the broken relationships, and to go on with a positive life. So that is basically what we do here. Okay, when you ask about the main cause of drug abuse, I will start by saying that I'm also in that bracket. I am a recovering addict, as you may like to call it, because I've faced that challenge of addiction in my life. And I was addicted to various drugs. I was drinking alcohol, I was chewing miraa, I was smoking marijuana, and I also had to face this journey. And that is why I'm giving back to society by trying to help these individuals. So when you talk about the causes, there are various causes. Yeah, some of them are things that we don't otherwise think about. Maybe the parental upbringing. There is what we call instrumental use. Instrumental use of drugs, we can say that maybe this child has grown up in a family with a lot of conflict. Maybe there is conflict between the parents, and these children who are vulnerable, they get these, I wouldn't call them negative, but I can call them unpleasant feelings. They grow up with unpleasant feelings of anger, sadness. Some of them develop resentments towards themselves. And when they get to a certain age, especially the teenage age, they feel they use drugs in order to get relief from these past memories. And as a result, they find themselves getting addicted to some drugs. Yes, the first step we take, first of all, we welcome you to our place. That is the first step, of course. And we try to find out, we carry out an assessment, which is called a biopsychosocial and spiritual and cultural assessment, where we try to find out really where you're coming from. How did you start using drugs? Is it in your family? Because addiction is genetic. And we also try to find if there are causes family related or other issues. We also carry out a drug test, because you'll find that many people who are into drug abuse, they really don't want to accept the total extent of their problem. So you'll find that someone will say, I only use alcohol. But when you get to do the test, you find that they were using other drugs. When I say other drugs, these days you find that people are even abusing over-the-counter drugs, yeah, which was not common back then, in some years back, but it is common that people are blending what we say these local drugs such as alcohol and miraa and marijuana and mixing them with this let me say some pills, injections that are available even over the counter. So we do that, we try to check, we do a test and we find out the extent of the problem, because you cannot treat if you do not know what you're treating. We also do a mental health assessment. So we have a professional psychiatrist who will assess them mentally just to know the other aspects of their disease. If maybe they are suffering from anxiety disorder, or maybe they are depressed, or maybe they have other, let me say, psychiatric problems, so that we can be able to treat the drug use or the addiction together with these other psychological conditions. The other thing we do is that maybe after a while we assign each and every patient a counselor. That is a private counselor, which they get to sit together and share those things that they wouldn't share as a group. We also carry out group sessions whereby there is one or two facilitators who are professional counselors, whereby the people here, they learn to interact with each other and to share in a group setting. It also helps to build and improve their confidence, and I think it's a good avenue for them to make good friends, of which they are walking along the same journey. I will say that the thing that makes alcohol to be abused mostly, because first of all, it is legal. Second thing, it is readily available, and it's also ingrained in our culture. Also, it is available and it is cheap. So anywhere you go, you'll find alcohol. It depends on the money that you have in your pocket. You can even find a drink for 10 bob, 20 bob. So it is cheap and readily available, and it is like part of our culture. So, but I would like to say that it is not only alcohol. You'll find that many of the patients that come here, most of them have had an encounter with alcohol. But there are also many drugs. Drug abuse is on the rise, mostly among the youths in Kenya. And you'll find that now, for instance, the majority of the patients we have here are suffering the effects of other drugs. And that is mostly marijuana and miraa, which is on the rise. And also those drugs that I was talking about, over-the-counter drugs, they are used to treat mental illnesses. But somewhere they find themselves in the wrong hands. So instead of treating those people in mental institutions, they use them to get that high. And that is also on the rise among the youth. So I can say that alcohol, there are those who are totally into alcohol, but according to this generation, this young generation that we have in our country, most of them are indulging in, let me say, many drugs. An assortment of different drugs. Before I answer that question, I would like to just give you a definition of addiction. Yeah? I will put it in a simple way. Addiction is giving up everything for one thing. You see, many people, they start their use socially. And during the social stage, they don't depend on the drug for anything. They use it to have fun. They use it as a means of, we are going out, this is a party, this is a birthday, it's the weekend and I've been working the whole week. That is how many people start. But now it gets to a point that your body adjusts to alcohol and your brain. It is a disease of the body, of the brain, and of the soul. So what happens when you get dependent on the drug, it gets to a point that you cannot survive without it. So you have to use in order to function as a human being. So you stop using it in order to gain pleasure, but you use it to avoid pain. Because if you don't use it, what happens? You get what we call withdrawal symptoms. Your brain and your body reacts negatively. So you'll find those people who are dependent, they have to use it in order to feel normal. So I will say, if we continue with this drinking culture, we are raising a doomed generation. Yes, especially among the young people, because these drugs have diverse effects on the minds of young people. You see, the brain stops developing at the age of 24, 25. And you see, these brains are not fully developed of these young people. So when they start indulging in alcohol and other drugs, what happens? There is this front part of the brain, which is called the prefrontal cortex. It is responsible for things such as decision making, making good decisions, knowing good and bad, planning for the future, you see. And if such of these things are distorted, if this part is distorted at that young age, you see, it will have dimmed their future. Yes. So I think that if that culture is not combated, uh, we won't really be celebrating in the future, but really we'll be trying to find a solution to a problem that we could have tried our best to prevent. Okay, I can start by saying that I've been there and I've done that. If you're struggling with drugs, you're struggling with addiction, that is not the end of life. Try to find help. I'm talking to parents out there. Don't discriminate against your child because they're using drugs. Do not hate them. The best counter is love. Try to understand them. Try to understand where they're coming from and try to get them help as soon as possible. If you're in that stage where you've started experimenting with drugs and you have not gotten to the point of dependence, you've not gotten to the point of you cannot do anything, you cannot survive without drugs, it is in your best interest to stop now while you can, because you will get to a point where you will be unable to stop, and then now we'll be looking for a solution, which sometimes doesn't work out. So I would say those parents who have children in this situation, help is available. I know maybe you've tried many things, but I can give you some hope and encouragement that they can turn their lives around and they can become better people. They can still pursue their goals and dreams. All is not lost. Okay, so for more inquiries, you can reach our director. His name is Gregory Moshiri on the number 0704 525 568. 0704 525 568. I urge you to try us. Have a lovely one.